Hello everybody. It's wonderful to be with all of you. A lot of messages have been pouring in and a lot of you have are joining with me. So big hi to all those of you who are over here. Sometimes the smallest step in the right direction ends up being the biggest step of your life. So tiptoe if you must, but take that step. So here I am, Dr.AKSHAY Rathi, and I'll be here with you discussing a few aspects of personal finance, practice management, and of course, being an orthodontist, I will be speaking something about ortho also. Let me start with a brief introduction about me. I'm Dr. Akshay Rathi, and this is the setup, Dr. Rathi's Dental Center. This is the proprietary firm of Dr. Seema Rathi, my better half, and I work in this clinic as a consultant orthodontist. I gave the Ministry of Health examination in Oman, and once every month I visit Oman as a consultant orthodontist. And this is these are a couple of pictures taken at the center at Oman. Last May, Dr. Ratin Das, who heads the Illusion wing of education, invited me to join hands with him and be the orthodontist on the faculty at Illusion Aligners. And for the past 1 year, I am proud to be associated with Sameer and Rajesh Bhai in Illusion Aligners, and I thank Dr. Ratin Das for that. And this is one of the passionate works of mine. I and my partner, Dr. Seema, we are very much into training, and this is OrthoTrain, our pet project where we train general dentists and specialists to practice fixed orthodontics in their clinics. I am proud to say that we are entering the 16th year of mentoring, and the 36th batch just started before the lockdown was announced. Everybody says that you one can be a self-made man, but here I acknowledge my family, my parents, my wife, my kids, and the experiences which have molded me with each and every one in whom contact I have come with. So a big thank you to all of you, and once again those who have joined me late, hi and welcome to all of you to this session. As an orthodontist, what does the first thing he talks about? The orthodontist, the first thing an orthodontist talks about is growth and development. Yes, but here, friends, this is not, I'm going to talk about the Michel's cartilage or the sutural theory of growth, but I'm going to talk about an exciting topic, the growth and development of finances. It's a huge topic, but the journey of 1,000 miles begins with a single step. So let us have a few aspects that we can discuss about it here. An asset is something which gives you returns. And today I'm going to speak to you about various asset classes. The various asset classes are equity, debt, bullion, real estate, and currency. I will go through each one of them slowly and make sure that you understand the basics of it. The first one is equity. Equity is basically the share market, and in equity you can participate either directly or via mutual funds. So if you want to enter into equity, then either you give in some time and study the various companies and try to find out which company will give you good return on a long term and stay invested in that. If we are too busy for that or not inclined to do that, then there are a variety of mutual funds which are available. Now, mutual funds basically fall into several categories, but the simple ones I will come across to you will be a large cap fund, a mid cap fund, a small cap fund, a balanced fund. So these are all the various funds which involve in which will put in your money into the share market after putting in their research and analysis. So as a beginner, it would be good to enter the stock market through the mutual fund route. For those who are into direct share trading, the only advice would be to use shares as a medium of investment and not for speculation. The next asset class I'm going to speak to you about is debt. By debt, we mean a source of investment or asset which gives you more or less fixed returns, such as an investment into a bank's fixed deposit, an investment into public provident fund, which we all can do, or you can go through debt mutual funds where you give the money to the mutual fund and they put it into various debt instruments. The next category is bullion, and this includes our investments into noble metals. The whole of India invests in gold, and we have been doing this not now but since ages, and India has the maximum gold deposits in the world, and India is also the biggest importer of gold. Gold gives us good returns over long term, and it is always advisable to put in some part of our asset into the gold. Then comes real estate. Real estate is also loved by all Indians, and everybody wants to have a share of the land or building, and that comes in real estate. But real estate should be basically used mainly for consumption, that is, you are using it to stay, like your house, or you have bought a clinic from which you are operating. Real estate investments can give you rental incomes. The other way to go into real estate is via real estate mutual funds, wherein, like I spoke to you about equity and debt, you give the money to a fund manager and the fund manager invests that money into the real estate. So here you can start off with a small ticket size and you don't need to purchase the entire property, and you become part owners of various properties that the fund manager will have invested in. And the last asset class over here is currency, and it's not a very easily tradable commodity. It is something like you have got a few dollars for yourself, and as the rupee devalues, your value of the investment in the terms of dollar increases. So if you have $100 which was there with you 10 years ago, that value in rupees will be superior today than what it was 10 years ago. These are the broad classification of the various asset classes. Now, if you go through this, the five asset classes, now how do we invest? How much percentage of our savings into which asset class? So a standard formula which is given by various fund managers and by various financial advisors is that 100 minus your age is the percentage of your amount or your money that should be invested in equity. So if you are 40 years old, your 60% of the investment should be in equity because it is an high risk investment. And as you are young, you are able to take more risks, and as you grow older, you remove some amount from the equity and put it into the debt and other asset classes. The Some fund managers now are more bullish on the equity market, and they also advise 110 minus your age or 120 minus your age, which has to be invested into the equity. So I hope I have given you a fairly good idea about the various asset classes and how should you go about investing in them. There are more asset classes which I would classify as exotic classes of assets, such as the cryptocurrency. The most common among in that is bitcoins. You can, once you have a grip of the equity market, go into derivatives and futures and options. You can do commodity trading on various platforms which are meant for commodity tradings. You can invest in startups, in hedge funds, arbitrage, private equity. So these are all the various exotic classes. And finally, if you are inclined to art, you may invest into painting and sculptures, or you may buy an investment into diamonds. So let me go ahead with all the these are the various asset classes that I have spoken to you: equity, debt, bullion, real estate, and currency. This is how we need to get a grip on how to approach personal finance. But remember, this is all passive income. And for you to put money into these asset classes, you first need to have active income. And let me now come to a distinction which is made by the finance people into two asset classes or two income classes, which are the active income and the passive income. It's not very difficult to understand. Active income is the income that you get from your main source of activity, such as my main active income is by working on patients in the dental setup that I referred to. The passive income is from all these various asset classes. For an active income, you need to work for 8 plus hours on a daily basis. You have to render a service, or you have to run a business actively, and the active income stops if you stop working. On the other hand, passive income is an income where you don't need to work on a daily basis. As compared to rendering a service, here you have an investment income, a rental income, or if you have written books, you will get royalties. And the passive income works even when you are not working. So money by itself is working for you in a passive mode of income. Now, why are we studying all this active and passive incomes? Money is important to all of us. So let us understand what is this active and passive income. The active income is the income that you get from working in your clinics. And after you deduct the expenses, after you deduct all the expenditure that you do in your personal life, the savings now are shifted into the passive asset classes. So whatever you save from the active income, you put it into the passive income. So if you have saved 0.2x of your income, that 0.2x will be considered as 100 when you put it into the asset classes, and 100 minus your age you will put it in equity and the rest into the other asset groups. So from your active income you are generating your daily expenses, your lifestyle expenses, and you are generating a savings part which you then put it into the passive asset class. You will achieve financial independence when the income from your passive asset classes exceeds all your living expenses. So it means that when your passive income is more than your daily expense, more than your lifestyle expense, more than the expenses that you have kept aside as an emergency fund, an expense which you have kept for future anticipated expenses, you have kept aside money for your health considerations and all that, then you achieve financial independence. Once again, I repeat, when your passive income exceeds all your living expenses, you achieve what is called as financial independence. What is the importance of financial independence? The importance of financial independence is that once you achieve the stage of financial independence, you no longer need to work for money. You need to work as an hobby. You need to work on the things which you consider make you happy, and that is not necessarily all that the work which you were doing before you got financial independence. So let me take the example of a dental clinic, and you may be more interested into doing only endo work, or you may be more interested into doing prosthetic work. Then what happens is, once you achieve a degree of financial independence, you can decide that I am going to work in this particular class or in this particular specialty in my clinic. Let me tell you, friends, that as professionals, we are never going to stop working. Our active income will be there throughout, because if we stop working we are going to stagnate, and we will just not be ourselves. So we are going to keep this active income going till the last day that we can, but at the same time we will strive to achieve financial independence so that we can do actively the work that we like to do most. So now comes that if I need to get financial independence, I need to have passive income which is going to be more than my daily expenses, and to have a more passive income, I should have a more active income, because active income is my initial source of investment into the passive income. The most important thing that you see on your screen is on your right hand side, and that is the question which should always play in your mind, and that question is how and how should I increase my active income? How should I go ahead and do my practice in such a way that I am going to my goal of financial independence at the earliest possible stage? The purpose of a business is to create a customer. This is what was given by none other than Peter Drucker, the management guru. So now let me come ahead and talk about how to keep ourselves focused on generating the active income. So here comes my first practice management tip, and this is the most essential tip. And if I were to give you one take home point that you would want from this presentation, it would be this, and that is to focus on the patient. What I mean by this is that our entire energies should be focused on delivering the best treatment to our patient, the most ambient treatment experience to our patient, and going ahead with the best relationship with our patient. So how do we do this? The first and foremost thing is to understand that for us to grow into the growth path, the most important part is to focus on satisfying the needs of our customers. And over here comes the focus on satisfying the primary needs of our patient. What does a patient expect from you? A patient expects good treatment. A patient expects a clean clinic. A patient expects sterilized environment. A patient expects a good approach by you and your supporting staff. And a patient expects a good follow-up of the treatment that you have rendered. So we have to not only focus on our basic skills, but we also need to focus on our soft skills so that we give the best that we can to our patients. So this would be the first goal that we should try to understand and focus our energies on. A lot of time we think about increasing our patient base, we think about marketing so that we can attract more patients, but we should always remember at heart that the best patient that we would have in today's era is a referred patient. And how do you increase your referral base? You increase your referral base by giving the best possible ambient treatment and having a very satisfied patient leave your clinic. So this is a, an area where you need to focus on the how. Put yourself into the patient's position and go ahead and start answering the how question so that you have a highly satisfied patient at the end of your treatment. Now, here we need to develop strategies to understand the chief complaint, to ask good questions to our patient, and to focus on our skills to give the least traumatic and most happy experience to our patient. In your dental practice, now I have a varied group listening to this presentation over here. So I'll be speaking to a group of section which is dental students and interns who are just going to enter into private practice, whereas on the other spectrum I have practitioners whose kids have become dentists and who are at the other end of the spectrum. But I will try to satisfy both the ends. In your practice, the first thing that you must build is skills. So you have to develop core skills and soft skills. What is a core skill and what is a soft skill? Core skill is the basic skill that we have learned from dentistry, and then we go on attending various continuous education courses, continuous dental education courses, and we go on updating our hard skills, our basic skills which is our dentistry skills. While we focus a lot of our energy into developing our core skills, we should always keep in mind that we are progressing towards a very nice development of soft skills also, which mainly include our communication skills with the patient, our relationship building with the patients, and the way we give an ambient experience to our dental patient. In our practice, we have to build trust, we have to build credibility. No patient must feel cheated, and that will come when no patient is cheated. Okay, so you have to have a very clear mindset about this, and there's no fast way to earning. You have to go on a steady path, and your practice must be built over years. I always give the example over here that your practice building should be like you are planting a tree, and over years the tree grows and gives you fruits on a regular basis. Practice should never be like fishing, where you are fishing a patient, and then what happens is that your patients are not going to give you more patients, but you are going to lose trust and credibility if your patient's chief complaint is not satisfied, or you have lagged somewhere in giving an ideal option to the patient. As you go on building trust and credibility, the byproducts are fame and reputation, and these two are linked, because if you create trust, you create a reputation, and to build the reputation, you have to create that amount of trust and credibility. The next thing that we focus in our dental practice is to develop systems and to develop the adequate infrastructure. This is something about our clinic setup, and by systems I refer to a management protocol which has to be followed with patients on a routine basis. So you can't think every time when a patient walks into your clinic with a chief complaint. Once you listen to your chief complaint, your mind must be compartmentalized to put that patient into a particular system, and that system starts rolling. For example, a patient comes to you with a pulpal exposure, and then you should have a proper system by which you follow this care, and you don't need to think about the ideal endodontic uh, protocol every time. There has to be a system which is incorporated. Your staff should be trained into the system, which will give you the proper instruments at the proper stage and take the proper x-rays. So by building the systems, what happens is that you reduce some amount of your mental strain, because now you have a procedure to fall back on. Similarly, you need to also create a system for emergencies. You need to create a system for failures. You need to create a system where there is always a plan B in case plan A does not work. Infrastructure is your clinic setup, is your chairs, is the investment that you make into technology, is the investment that you make into acquiring new skills and implementing the newer processes into your practices. And finally, in your dental practice, you must also build networks. So you have a network which you build. This is your social network, this is your network of patients, this is your network of referrals, this is your network of co-medical specialists, this is your network of dentists working with you, around you, and mentoring you, and the practice grows with all these 5 points. And what do you do when you go ahead with all these 5 points, you aim for a leadership status in your particular field, in your particular area. So in your dental practice, now this was for those who have just entered, and now I would like to speak to them who have already done all this and they have already achieved a leadership status, and now it's the time for them to capitalize on this leadership status. So your past has already prepared you and you are already working, or you have created systems which are working in this particular manner. So now I come to the next topic for what I was going to speak to you about, and that is how to make orthodontics a second career choice for dentists. This is what I like to refer to as Rachidontics. Why do you need, what is a second career? A second career is something which you will do actively to promote your active income. And when does it come into picture? It comes into picture when you have already established systems in place for your first career, that is your general dental practice. A lot of your bandwidth, which was used up initially with each new patient coming into the clinic, is now already in place, and now you have the bandwidth which is left to go ahead with a second career in your practice. And why do we need a second career? The second career is needed because of the reasons which I will be elaborating now. I hope the screen is visible, and I hope that I'm going at a comfortable pace for all of you to understand. I would be happy if you would take a pen and paper and jot down few points, and then you can go ahead and come back to me with those points when we go ahead with the question answer session. Everybody wants to make money, and that is the reality. When we say that money is important, all of us understands that, and it is necessary that we come into a mindset where we are thinking actively about making money. We are thinking actively about various financial strategies, of various monetization strategies to achieve our path to financial freedom. Most successful entrepreneurs believe that the best way to earn a steady stream of income is having multiple sources of income. So you cannot rely on a single source of income, and this is quite evident to all of us who are in practice that our clinics have been locked down and will continue to lock down in several places for an extended period of time. Even when the lockdown is called off, it will be quite some time, because the economy will be in recession, that our patients come to us for not only emergency dental procedures but for active and elective procedures. The average millionaires have about 7 streams of income on an average, and the largest percentage of people have active incomes, and this active income then propels the savings component into the passive mode. And finally, my dear friends, without diverse sources of active income, you will be risking a lot. And that is why one thing which you should do into this lockdown period is to understand the rest of your practice, the rest of your career requirements before you go into practice again, as this is the time when you can go back and reflect on everything. Let me give you an example of Blackberry. This was their most famous model for several years, and Blackberry was one of the leading manufacturers of quality phones. They had started with PDAs and then they moved into phones. And this was, they had their own private messaging service. I don't know even if the newer lot of the audience who is there might have heard about Blackberry also, because the Blackberry phone lost its relevance. It did not go ahead with the modernization. It did not, it stuck to its QWERTY pad for an extended period, and then it could not be recognized as a trendy phone, and it started losing its business. So the most important fact that I'm going to speak to you again with respect to your practice is to stay relevant to your patients. And how do you stay relevant? The only way that you can stay relevant is that you update yourselves. And this updation is not only by going to a single conference or by attending a particular study group, but it has to be done on a committed basis persistently, so that you stay relevant to your patients. Updating your skills is something which I have learned from all my mentors. I have been into practice for now 25 years, and I have been associated with all the good names in dentistry. And the one important thing that all of them do persistently is to have a committed learning approach, a committed approach of updating the skills. Nobody can rest on their laurels. They have to keep on learning, because everything that is in the changing environment that we have right now, things can become irrelevant before you really understand them. So you have to incorporate change, and you have to constantly create a mindset where you are staying relevant by updating your skills. Now, this is one concept which I have learned a lot from my senior practitioners, and I have incorporated into my practice, and I would like you also to start thinking in terms of income per hour. What is this income per hour and what is its importance? Let me show you what is this calculation. Now, gross income is your total income from the patients. Say, for example, you have worked in your clinic for a period of 1 month, and you have totaled your income, and that comes to X. Now you have to deduct your electricity bills, your lab bills, the salaries that you pay to your staff, the amount that you have incurred on the various materials, the amount that you have spent to the lab, all that, and this will become Y. So your net income will be X minus Y. It's a very simple calculation, and this has to be done by everybody. And most of you do this and come at this figure of net income, and you say that you have an annual income of so and so, or you divide that annual income by 12 and you say that you have a monthly income of so and so. But now let me take you one step further. So now you have got your net income, which is equal to X, your gross income, minus Y, your expenses, and this becomes your net income. Now calculate your working hours. So for example, if you open your clinic in the morning for your morning session of about 4 hours and an evening session of about 4 hours, then you're working for 8 hours. You're working for 6 days, this becomes 8 6 are 48, and you are working for 4 weeks, so it roughly comes to about 200 hours that you are working in a month. This is variable for each one of you. Some of you might like to work on Sunday mornings, some of you might not like to work on Saturday evenings, some of you might like to take a mid-week break. That's fine, you don't need to change anything of that, but what you need to be aware is your working hours. And now what you do is you have this figure of net income, which was X minus Y. You divide it by your working hours to come to a figure which is called as income per hour. So let me show it to you with the help of a rough calculation. Say your net income, that is your income minus your expenses, is 1 lakh per month, and your working hours, like I told you, is 4 hours in the morning, 4 hours in the evening, 6 days a week. It comes to about roughly 200 per hours. So now what happens is that your income per hour of work is rupees 500. If this same net income was 2 lakhs, then your income per hour would be 1000. If this 2 lakhs you earned by working one session, that is in 100 hours, then your income per hour would be 2000. All good entrepreneurs will work on an income per hour. Now there is a very big significance to this when you start calculating your income per hour. Say if you are working the whole month, then you start your practice on Monday, and then you may feel a little lethargic. There will be Monday blues, and then you slowly build into your practice, and by the time you reach Thursday, you're looking forward to the weekend, and you reduce your work load on Friday, and so on and so forth. So if you are calculating your income on a monthly basis or on an annual basis, you are not looking at the time which you are unnecessarily wasting. Your income per hour is very high, so utilize it properly and do not spend the working time into time spent on reading newspapers or going through emails or doing unnecessary work. Once you understand your income per hour, you will be able to value time, and you will be spending each hour in an intelligent manner. So do this exercise and come to an income per hour, because this is again important to something which I am going to speak further to you. Now my dear friends, all this that I am talking to you has got nothing absolutely to do with orthodontics per se, because I wanted to speak on a topic which would be relevant to you once you come out of this lockdown and go again into your routines. So this is something which will help you come out and be successful ahead in your practices. How do we increase the income per hour? There are basically only two options. First would be to increase the number of working hours. Do you think this is possible? It's very difficult. Or dentistry per se is a back breaking exercise, and if we have to do quality work, we have to restrict our working hours to a certain limit which is set by all of us, and obviously as we go on aging, the number of working hours also come down. So what is the other way of increasing this income per hour? The other way of increasing the income per hour is to increase the procedures that pay you more every hour. So you have to focus your energies into doing those procedures that will pay you more on an hourly basis. The third option, I'm not going to speak to that, and that is reduce the expenses. But again, there is a compromise on the quality of our work. There is a compromise on the focus of towards our patient, and therefore this is not advisable. So here I want you to give another business axiom which is known as the Pareto's Principle or the 80-20 rule, which was originally through sales, that 80% of your sales comes from 20% of the clients. So what does this mean? It means that if you are earning 100 rupees, 80% or 80 rupees of that particular proportion will come from 20% of your clients. Dentistry is also a type of sale because here your product is your service, the dental service that you are rendering to your patient. So 80% of your income comes from 20% of your work, and the rest of the 20% of your income comes from 80% of the work. And if you were to categorize it further, 90% of your income would come from 10% of the work that you do in your practice. So now, as you want to increase your active income, you cannot go into economics of scale. That means if you were earning X rupees per hour, you cannot go on increasing the number of hours to increase this income. So now we have to go to an economy of innovation, and we have to understand the procedures in our dental practice that are going to give us a good return. How long does a full-fledged all four extraction case take? This is an ortho patient who has got bimaxillary proclination or who has got class 2, and we are going ahead with upper premolar extractions, or in a class 1 with all four extractions. And routinely we tell our patients that the treatment duration is 1.5 to 2 years or 18 to 24 months. Now, when I say this to my patient that your treatment duration is going to be 2 years excluding the retention phase or 1.5 years excluding the retention phase, then, and if I'm charging an amount of X to my patient, what is it that I'm making? It's going to take me 18 months to realize that small amount that I'm going to get on a monthly basis. And what is this income per hour that I was speaking to you about? Now, I will approach this question to you from a different angle. How long does it take clinically for you to do an full-fledged all four extraction ortho case? And the time duration when it comes to clinical practice is 3 to 3.5 hours on the dental chair. In fact, I would be spending another 3 to 3.5 hours talking to the patient, because most of the time that I require to change an arch wire is hardly a minute. The time that I require to bond an arch is about 15 minutes. So a full-fledged case takes me about 3.5 hours. But can I do that 3.5 hours immediately? No. This 3.5 hours are split over 18 to 24 months. So if I'm doing the upper arch bonding, it will take me 15 minutes. The lower arch bonding, it will take me 15 minutes. and if there are breakages or if I am doing wire changes, then each appointment would be 5 minutes, 10 minutes. I'll be spending half an hour on doing a fixed retention. So overall, I'm going to spend 3 to 3.5 hours. And now when I correlate this with the cost that I'm charging the patient with the output that I'm getting, I come to a true picture of income per hour. So in your practice, what you have to do, friends, is to focus on procedures which are going to give you good incomes per hour, and focus your energies towards learning those and doing most of them yourselves so that your income per hour increases. It's not that you can do only that work, but what happens is when your focus is on that 20% work or on that 3 to 5 procedures which are giving you the maximum returns, your practice will start building up because you'll be doing more of this work and the other work will also increase. The only thing which happens, which is irreversible in orthodontics, is extraction. And as long as I have not done extraction in my patient, whatever work that I do is totally reversible, because the basic premise of orthodontics is to apply force to a tooth, and when you apply the force to a tooth, that tooth will move unless it is ankylosed. So this is something which I want to tell you, is that whenever you are doing an ortho procedure, you are moving from A to Z, but with each particular passing day or passing appointment, you are moving towards a more idealized occlusion, towards a more normalized occlusion, and there is nothing that can go wrong if you are following proper principles of science. I hope that this presentation till now is making some sense to you, and you are going to go ahead and listen to the rest of my presentation with the clarity that you have now achieved with respect to your finances. We all have a story to tell, but let me tell you the story of a successful businessman. Let me come to Jeff Bezos. Now, one important principle which you must follow in your practice is to follow successful people, is to follow people who have achieved success in our domain, and to follow people who have achieved success in other domains. So these people, they have already laid out a clear cut blueprint or chart to you, and if you follow that, there is no way you are not going to be successful. So let me tell you this story about Jeff Bezos. He had a very high paying job and he was doing very good in his career. But then he left the job and he started an entrepreneur firm, Cadabra, which was a short form of Abracadabra, in Seattle. And this firm, Cadabra, he later named it as Amazon. Why he named it Amazon? Because it was the largest collection of books that he had. He had the largest collection of online books, and Amazon was the largest river. So he correlated this two and named his enterprise as Amazon. The A to Z arrow came much later. He started by selling only books online. He did remarkably well in his enterprise because it was a very wonderful business model at that time. We are talking of 1990s, not a very huge time behind. I did my BDS from 1990 to 95 and my post graduation under Dr. Wadkar at Nair Hospital Dental College from 96 to 98. So this was a remarkably good business model. But then Jeff Bezos, what does he say about his business? He says that you should have an obsessive compulsive focus on the customer. And this is how he describes his most basic tenet in running the business. Of course, there are a lot of points, but this is one point which he will focus on every time he speaks, every time he lectures, every time he gives an interview. That is to have an obsessive compulsive focus on the customer. This is amazing. The rules of successful businesses have changed. We no longer are in an era where we say that our enterprise should maximize profits at all costs, and that is not a principle to do entrepreneurship. The principle is to go about ethically, is to go about doing what is the best for our patient, and as we help other people achieve their goals, we achieve our goals. As we make other people smile, we get to smile ourselves. As we make other people more confident, we get a good night's sleep. So we need to be compulsively focused on our patients. Now, Jeff Bezos, he had this business of online selling of books. And now the interesting part comes, which I want to stress to you. How did he plan his expansion? So he wrote to a certain amount of his customers and asked them as to what they would like Amazon to bring to them, what they would like Amazon to sell to them besides books, and he got a variety of answers, a multitude of responses, and then Amazon started the venture further into electronics, into electricals, and into all the goods, and now it is a behemoth. So this is the success that was achieved by Jeff Bezos in a lifetime, and this is what we should take our inspiration from. We need to go ahead and study a lot of these successful people to know their mindset and to realize what we want to how they became successful. Because if you want to become successful, the simplest way is to do what successful people have done. If you are following their principles, there is no way that you can go wrong. So what is the relevance of this story? What does this Jeff Bezos story tell us? Let me give you the insight. If you follow this protocol and ask even 100 of your satisfied patients that what is it that you would want from you as a doctor, what is it that the patient would want from you as a doctor, I know you would have guessed the response because you would have listened to this so many times in your practice, and that is what the patient tells you, that I want you to do my treatment. The patient trusts you, the patient has, you have built an credibility with the patient, you have built a fame and reputation, and now the patient wants you to do the treatment. And dear dental colleagues, this includes all dental treatment, including orthodontic treatment. Of course, you would be most happy to leave this section to your consultant and take that session off, but what is important is to understand the practice point of view and realize that your patients would be most happy if you would do all the treatment. Now, if you were to do all the treatment, the most basic question is that you would have to learn orthodontics, and learning is a process. It is not overnight. It's not just reading a book. It's not just doing a weekend course. It's not even just attending a conference. But it is a journey which you need to take. It is a process that you have to build into your mindset, that I want to learn something, because that learning is going to be good for me. Whenever you decide to focus or to increase your specialty of treatment, that means that you try to incorporate implants, you try to incorporate lasers, you try to incorporate orthodontics, you try to incorporate a new procedure in implantology, you try to incorporate or do good aesthetic work or good composite work from the work that you are already doing, then you have to go with the mindset that you must go with the best course that is available at that time. And there is abundant real-time information now. All of you have been inundated by your WhatsApp messages informing you about the rapid increase in the number of webinars that are taking place. Even this webinar might be overlapping with few more webinars. So the Google, the net, the modern sources of information give us an abundant real-time information, but what is important is to filter the information that will be most useful to us in our practices. What is the use of this information? The use of this information is to make you clinical relevant. Remember the Blackberry phone example that I gave you? If you don't become relevant, you will shut shop. So you need to remain relevant clinically. You need to do a course, or you need to follow a mentor who follows evidence-based principles and not opinion-based principles. It should not be, this is an overall picture that I am giving you with respect to all the courses that you would be attending. You cannot have something which works in my hands, because the mentor's hands are not going to be there in your clinic. It has to follow evidence-based principles, and it should work in everybody's hands. Of course, there are more than one correct ways of doing things, but you should know at least one correct way. So this would be following evidence-based principles. The information that you are getting must be time tested. It should not be a new source of income. It should not be that somebody is just completed and teaching you. What is the need for doing this time testing is that you should have an experienced mentor. Experience does not come with age. Experience comes with mistakes. So what happens when a mentor is teaching you something based on experience is that he is teaching you based on his failures. When a mentor says that this thing is to be avoided, then you have to make sure that you never do the way that the mentor has told it should not be done. This is another takeaway point that I would like you to note down, that if you are attending to any lecture and if the speaker says that this should not be done, make a note, the speaker has done that and he has come ahead with a mistake. So this is how experience is built. Experience is built on mistakes. The only thing which a correctly done procedure builds up is self-esteem and ego. But we need an experienced mentor to teach us the right things. This experienced mentor should be with you and provide you with continued support, because there will be updates, there will be things which you will forget and you will need revision, there will be things where you will need hand holding. And finally, you should have positive reviews about the mentor from where you are doing the course, because that person has already taught to so many people, and if they are able to implement certain things positively into their clinic, then you will be able to do that into your practices. So this is something which I wanted to share with all of you with respect to your learning process, because this lockdown period has given you with abundant real-time information. Are you good in your composite work? Can you maintain isolation? Can you do shade matching? Are you good in your prosthetic work? Can you create good margins for your restorations? If the answer is yes, if you have a good aesthetic sense, if you have good analytical skills, if you have spent such a large time in your lifetime devoting to learning principles of occlusion, to learning principles of aesthetic into the smile, then you need to look at orthodontics as a science which you can incorporate into your practices to give you an additional line of active income in your practices. Yes, so if you were to start ortho, then there are a lot of things which play in your mind. Let me go through this because I have been teaching ortho via my ortho train program for 15 years now, and I know a lot of myths which are far away from reality with respect to incorporating orthodontics into general dentistry. The first and foremost myth: orthodontics is not dentistry. Yes, a lot of us believe that there is one BDS degree, and this degree does not give you the right to practice ortho. But this is so misleading. It's a myth. Orthodontics is one of the 8 branches in which you gave your exams in the final year. So you cannot think of dentistry separately from orthodontics. Yes, it is true that at a basic level you do not have the necessary skills to practice orthodontics, but that does not mean that orthodontics is an allied science or is an alien science. The second myth: orthodontics is all about making straight wires, circles, triangles, U's, V's. That was just for you to get a hang of using the pliers. But orthodontics is not about only wire bending, because at present there is a multitude of material that is available where all your forms are given pre-formed by the manufacturer, and you could practice orthodontics without knowing also about wire bending. Orthodontics is all about growth and development, about Michel's cartilage, about sutural theory, about V-shaped expansion, about Enlow's principles. Yes, but like I told you, we are going to talk about orthodontics with respect to growth and development of finances. Orthodontists will hate you. That's not true. A lot of my friends are orthodontists. My colleagues who did ortho with me are still my friends. A lot of orthodontists who want to stop consulting bring the general dentist to me and tell me that please coach him because I want to stop visiting at that particular place. So I receive a couple of dentists in my courses every year who are referred to by none other than orthodontists. Orthodontics can be done only by orthodontists. That's the biggest myth of all, and that myth I am not going to break for you. That myth will be broken to you by our ruling authority, the Dental Council of India, which has its code of ethics, and the code of ethics says that a general dental surgeon can practice all branches of dentistry provided he shows adequate qualification, competence and bona fide training in the concerned branch or branches. You don't need to be an endodontist to do a root canal. You don't need to be a prosthodontist to do a crown and bridge procedure. Similarly, your dental degree is strong enough for you to do fixed orthodontics into your practices legally and ethically. So now what is the global scene with respect to general dentists practicing orthodontics? Now I did a lot of research for this and I came out with 4 or 5 slides with respect to various areas of the globe. In UK, the GDC, the General Dental Council, which is similar to the DCI of India, regulates that dentists can do all branches of dentistry as long as they feel competent to do so. However, orthodontics is a very specific area of expertise. If you want to be called as a specialist orthodontist, then you need a specialized training for that. So it's not that general dentists can't do ortho, but it simply means that general dentists, if they do a course or if they learn by themselves and practice orthodontics, they cannot call themselves as an orthodontist. Australia, any dentist is legally able to perform orthodontic treatment. Again, the same criteria. If you want to be listed as an orthodontist, you need to go ahead with a 3-year full-time training. Now, this is a very nice study which was reported from Canada, which shows that there is a 34% rise in dentists who are performing orthodontic treatments. Now, let me quote a study which was published about 25 years ago in none other than the American Journal of Orthodontics and Dentofacial Orthopedics by a most renowned orthodontist in the field, James McNamara. And he said 25 years ago that close to 20% dentists in US provide fixed comprehensive treatment to their patients. 57% provide limited orthodontic treatment, and it's only 1/4 of the general dentists who do not provide any orthodontic services. Orthodontist as a profession has progressed rapidly. Orthodontistry as a profession now has become more user friendly. It has had newer approaches, and the latest approach being that introduced by Invisalign in the form of an aligner mode of treatment. And we have several aligner companies now in India and abroad who will help you to provide orthodontic treatment into your practices. As I told you in the beginning of the lecture, and for those who would have missed it, Dr. Ratindas invited me to be a part of illusion training and education, and I am the head of the aligner wing, the illusion aligner wing, and I take care of the innovation and the training aspect in that particular branch. So we have already conducted a lot of training programs, and a lot of general dentists have already started doing this premium treatment for their patients themselves. To summarize, with respect to dentists performing general dentists performing orthodontics, the type of internal turf war is not productive. That means the turf war between the orthodontist and the general dentist. Taking pot shots at colleagues can result in collateral damage that is entirely avoidable. General dentists can do whatever falls under a dental license. End of the story. Ethical issues are the purview of the individual and the licensing authority. Believe me, friends, all of us want to do ethical dentistry. We will never do an endo where it is not indicated. We will never do an extraction where we can save a tooth. We will never put an implant in an improper direction once we know that it is prosthetically driven. When we are doing everything which is within the purview of our license, then why not include orthodontics also into that? So what Andrew Thompson has suggested is that it would be more important that the general dental practitioners and specialists spend their advertising budget and their marketing energies on attracting the significant section of the population that still does not access orthodontic treatment in spite of having a need for that, in spite of having a malocclusion. So if we were to include all the patients that would need orthodontic treatment, believe me, the orthodontic community would feel short to provide these services, and it would need the services of a general dentist. So our energies as specialists should be on increasing the pie itself and not on getting the maximum section from a pie. This is another beautiful thing which I came across while I was researching. Orthodontics is dentistry, and it should not, by default, design, or monopolization, become excluded from the general dental practitioners range of treatments available to their patients. Friends, I am coming to an end of the presentation, and here I would like to quote Zig Ziglar, who says, "Far too many people have no idea what they can do because all they have been told is what they can't do." A few pictures from orthodontics and a few treated cases by dentists who have attended my OrthoTrain program. Look at the quality of the results that is achieved by proper dedication and commitment. Hi Tarun, hi Arun, if you are here, a big hi to you. Look at the case which he has presented to me on last Guru Purnima. It's a fabulously treated case, and this has been done by just following the proper principles that are taught during the process of orthotrain. Another case presented by Dr. Pankaj Desle, and look at the patient satisfaction that would be achieved. I have not put in the facial pictures even though I have them for the sake of the privacy of our patients, but these patients, they would not mind coming over here and saying that Dr. Pankaj Desle or Dr. Arun or any of my dentist friends who has learned and is implementing the principles properly, that they have done a good job. This is a post that I put on Instagram and on Facebook. This is my case where I am doing a bit of intrusion of the two molars at my center. But look at this case. This case is done by my ortho trainee, the same Dr. Pankaj Desle. And there are numerous such examples that I can give to you where of my participants have come across and have done a lot of cases in their practices. So a lot of this group might also have be listening to this presentation, and a big hi and hello to all of you. This was the last training program that we started, and like I told you, this was just before the lockdown was announced. From 12th to 15th of March was the first session of the 36th batch of AutoTrain, and you can see that I am using a lot of innovative products to bring about the required transmission of knowledge from my end to the general dentist. But here I have included this important slide. Look at this. This is my participant from the 31st batch. Hi Resham, if you are here listening to this, I had called Resham and a few of the colleagues from her batch to come and do a presentation of their cases during the OrthoTrain program, and so that people get the confidence which already my ortho trained doctors have. A wonderful uh, thing that is developed by my batchmate, Dr. Prashant Shirude, a new facility where I go and impart the same quality training and exposure to live patients at the setup at Nasik. Hi Prashant, how are you doing? And here also I have a couple of my past ortho trainees. Smita Kapadnis is there and Prasad is there, who are presenting their cases to my Nasik batch. I have done similar batches in Bhubaneswar, I have done a batch in Ranchi, and soon this OrthoTrain program will be at several centers across India. I have incorporated few techniques into my practices which are easy and simple to implement, and this is something which I teach to my patient, to my ortho trainees. Apically, we will make an osteotomy about 2 millimeters into the bone. This is a very thin paper scissor, and this is your osteotomy. And then you take your micro implant. Here we are using a 1.4 by 8 mm micro implant. See the angulation 45 degree. See that I am interdental in between the roots, and I screw in the micro implant. The training program that I do incorporates a lot of these procedures. I am just sharing a small snapshot with all of you. Maybe it's also doing a revision for my ortho trainees. The time from the osteotomy to the placement of the implant was less than 30 seconds. This is a live video which was recorded. And this is one of the hands-on courses which hands-on exercises which happens on in the last module of OrthoTrain, where we do the micro implant placement on sheep jaws. I have been doing a lot of training programs, a lot of mentoring programs with various forums such as with FEMDENT, with Indian Dental Association, the main branch, the Mumbai branch, with various other branches, and I'm getting a good response because everybody wants to learn more and more in dentistry. This was a beautiful program which was organized by Dr. Devidas at the APJ Kalam Institute, not institute, at the center which is so nicely developed by Dr. Dhoble, the IDA headquarters opposite Siddhivinayak in Mumbai, and a small snapshot of that, and my colleagues who helped me in doing the course with them. Let me go one step further. These were cases which they have done and presented. This is a case which has been published, and it's not a simple case. Look at this. This is the pre treatment OPG of a patient, and the patient comes to the general dentist, and the patient says, I can't bite from the left side of my jaw. Obviously he won't be able to bite because only one molar is giving him the biting force. So we removed the 8, we placed a micro implant, we uprighted the 7, and we brought this into alignment. And when I say we, I was only a person who was coordinating over WhatsApp. The entire procedure was done by one of the participants from the 28th group of OrthoTrain, from the 28th batch. That was Dr. Hemant Jadhav. He is such a good student of mine. He is now doing his post graduation in prosthetics, and these are a few pictures from his batch. Hemant is not on Facebook, so he would not be listening, but this is the case which was published by Hemant, and this is the pre and post intraoral pictures and the OPG showing a great result that can be achieved by a proper application of knowledge even by general dentists. So the sky is the limit, and a trained general dentist can do wonders. Orthodontics, like dentistry, is a skill and not a talent. Skills are something which can be learned. You don't need to be born with them. You have to be trained to do a particular skill. Talent is different. You do not get, you are born with a talent. Nobody is a born dentist. Everybody has to learn dentistry, and orthodontics, which is not like dentistry, which is a branch of dentistry, is a skill which can be learned, and it's not a talent. So orchestrate the learning orthodontics into your to-do list, which I hope all of you are preparing in this lockdown. As you decide, as you come out of this lockdown, you must have with you a written set of goals, period, a written set of to-do list along with the time that you would give it. You cannot have a to-do list which is spread over 5 years. Of course, the goals have to be spread, but there has to be an immediate goal, there has to be an intermediate goal, and there has to be a long-term goal. Overcome the mental hurdles that play in your mind with respect to incorporating a new active source of livelihood towards achieving financial freedom. If you don't come out of this lockdown with a new skill, with more knowledge, or with better health and fitness, you never lacked time, you only lacked the discipline to do it. Now, what this lockdown has done to me is most visible to all of you on my face. Yeah. So this lockdown has added a lot of facial hair, which would not be there when I would be seeing patients on a day-to-day basis. Thank you, all the friends, all the dental fraternity, and all my teachers, all my colleagues, all my students who have joined me in this presentation, which I could bring to you courtesy the World Dental Association. Thank you, friends. Uh, Now we shall take questions, and just give me a couple of minutes. Write down your questions and let me see how this is to be coordinated so that I can answer your questions. Meanwhile, while this is being done, I will leave you with the last slide for you to ponder over it. Hello. Akshay, how do I access the questions from the participants?
You just have to choose video capture device and go on your FB Live. Close the presentation and go on FB Live.
FB Live.
Just close the presentation and go on the.
Yeah.
Yeah.
One second, hold on. Yeah. Yes.
Can you see yourself now?
Yes.
Minimize OBS.
Minimize UTs.
Yeah, OBS is downloading. I need to. Yeah. Here are the questions.
Can you see the questions on the right?
Yeah, questions I can see.
Yeah. So you can answer them already.
Okay.
Yeah.
Okay.
Yes. It's nice to have friends from the next generation. Yes, because they are helping me out to take these questions. Thank you, everyone. Thank you, Khan. Thank you, Maria. Let me scroll down. Thank you, Surbi. Yeah. The first question: if patients' lower anterior have localized periodontitis and teeth are grade 1 mobile, which is not curable by scaling and root planing, what can we do? Well, Surbhi, this would not qualify like as an ortho question, and you would have to ask this question to a perio friend and go ahead with that, because I will not be able to answer the non-orthodontic questions, because since the time I did my post graduation, which is I started on 2nd of Jan 1996, I have been only into orthodontic practice, and there's nothing of general dentistry that I am doing since the past 25 years. So I am not in a position to answer that question. Thank you, Ruxana. Thank you, Vinayak. Thank you, Ritu. I don't know if I can take in more of the messages. Let me go through one more way where I can go through this.
Thank you, Ruxana. Thank you, Vinayak. Thank you, Ritu.
Thank you, Dilip, for joining me. Dilip Gotwal and me go back a lot, and I'm very happy that you could attend this with me. And I was at his Paratwada branch last year and did the a nice interdisciplinary session over there. Thank you. Gaurav, thank you. Nice to see you too, taking an active interest and being here. Hi Arun. Hello Aparna. Hello Aniket. Thank you all for joining me. This was one of my first sessions with the World Dental Association, and I really appreciate them for doing an excellent job. They have a nice team which did a lot of the arrangements. It's not a very simple procedure, and I'm very happy the way that these things have turned out. So with this, friends, I'll take, I'll give a goodbye to all of you, my best wishes to all of you, and if there are some follow-up questions, they will be in written mode on either my page or the page of World Dental Association on Facebook, and rest assured, I will come back to you with all the answers. Thank you, everybody, and have a safe, corona free day and days ahead. Bye for now.